Welcome to our In Focus discussion tonight on curbing the COVID-19 virus. Residents living at long-term healthcare facilities were one of the hardest hit groups by the pandemic in Utah and all across our country. But things are finally looking up as some facilities have opened up and now allowing friends and family to visit. Joining us now live in studio is Allie Spangler, Chief Operating Officer for the Utah Healthcare Association. Allie, it's great to have you back on the show. Thank you for joining us again.
Of course, thanks for having me.
Allie, one of the groups that have been hardest hit by the pandemic, as we said, were those residents living in long-term healthcare facilities. Could you provide us some data and information that puts this into perspective?
Sure. So in Utah's long-term care facilities, we have around 18,000 residents. And as you know, older adults, especially those living in long-term care, are more vulnerable and susceptible to getting COVID-19 and dying from COVID-19. Out of the around 2,000 deaths that we've had from COVID in Utah, just under 700 of those have been in long-term care facilities. And to put that in a little bit more perspective, that's about 1 out of every 26 residents in long-term care facilities have died. So it's definitely been very impactful for our long-term care residents.
It has been such a hard time for them. So what would you say was the mental and emotional impact for these residents who were not only more at risk of dying from the virus, but were being completely isolated from the outside world?
Definitely. I mean, these long-term care facilities are their homes. And at the rise of the pandemic, as things were escalating because they are more vulnerable, these long-term care facilities had to shut down. They weren't allowing any non-essential visitors into these facilities, and the residents weren't able to come and go as they please like they are on a normal basis. Because of that, we've seen an increase in depression, anxiety, loneliness, isolation. The facilities had to get really creative in how they were helping these residents to not feel so isolated. You've probably seen lots of pictures and videos of drive-by visitation, window visits. They weren't able to have group dining or activities, so they were also having to come up with some fun ways to be able to do activities on a smaller scale or in their rooms. They facilitated telehealth and FaceTime or Skype calls, and none of these things replace being able to have that contact with their loved ones, having their loved ones come in, going out for holidays and celebrations. So it has been a very difficult and impactful time and lonely time for the residents in long-term care.
And we really have to give a shout out to the staff members who work at these facilities because they care about the residents so much. Now, what kind of impact did we see on these facilities after the residents began getting vaccinated in December?
Sure. So since vaccinations began in long-term care in December, we have seen a significant decline in outbreaks and deaths in long-term care facilities. At the peak in November and December, we were seeing around 150, 160 outbreaks in long-term care facilities a week. And just this last week, we are at less than 20. So it has been such a reprieve for these facilities who have been working so hard to try to avoid these COVID-19 outbreaks over the last year.
That is such great news. So how are we doing so far with vaccinations in these facilities? Meaning how many residents or staff members have been vaccinated so far?
Yeah, I'd really just like to applaud Utah in prioritizing long-term care, not only the staff, but the residents. Utah is one of the only states in the country that prioritized long-term care as highly as they did. And because of that, every single long-term care facility in the state has had at least 3 opportunities to vaccinate their residents and their staff. And what this translates to is to around 90% of residents have been vaccinated in long-term care facilities in Utah. Additionally, around 70% of staff have been vaccinated, which is a huge, huge accomplishment, especially when we were forecasting numbers for the staff. It was only around 40 to 50%. So we are extremely happy with how we've been able to handle vaccinations in long-term care so far.
Now, those are great numbers. Allie, we have about a minute left. I want to get 2 more questions in. What does this mean now for visitation? Who can visit these residents, and do they need to be vaccinated too?
Sure. So just recently, last week, the Center for Medicare and Medicaid Services released some new guidance for long-term care facilities. People vaccinated or not can enter these facilities. Now, they still have some infection control practices, masking, some social distancing. But what's so great is if the resident chooses, they can have that contact, they can hug, they can see their loved ones. And it's just amazing to be able to, help these residents and not have that loneliness anymore and see their loved ones after a really long year.
This warms my heart so much. All right, Allie, 30 seconds left. It feels like the light at the end of the tunnel is near. What's next for our long-term healthcare facilities, or what's the next step in hopefully bringing this pandemic to an end?
Sure. So I think the next steps are really going to continue to be determined by the CDC and, infectious disease doctors. But, we are in that most important step that we can do right now, vaccinations. We've done a great job in long-term care, and we just hope that the community can continue with this uptake and that we will be able to move forward and hopefully see what those next steps are and continue seeing that light at the end of the tunnel in long-term care and in our entire community.
I hope so too. You've been hearing from Allie Spangler, Chief Operating Officer for the Utah Healthcare Association. Allie, thanks for joining our discussion tonight. We always appreciate your time.
Thank you.
Thanks for staying with us for our In Focus discussion tonight on curbing the COVID-19 virus. Navajo Nation once had the highest COVID-19 infection rate in the country as an area that was disproportionately impacted by the virus. This week, health experts there reported 0 new positive cases for COVID-19 and deaths for the first time in 6 months. So what were some of the successful measures that tribal leaders implemented that contributed to these declining numbers? Joining us now live via Zoom is Navajo Nation President Jonathan Nez. President Nez, thank you for making time to join our discussion tonight. It's great to see you.
Thanks for having us, Rosie.
President Nez, how did you feel, or what were your initial thoughts when you heard that Navajo Nation had reached 0 cases of new COVID-19 cases and deaths this week?
Well, I first want to say, Rosie, a big thank you to the Navajo people. They've been on the front lines of this pandemic for over a year now. And because of their hard work, following through on the public health mandates here on the Navajo Nation, and as well as the large percentage of vaccinations, we have seen an all-time low. And on Monday, as you mentioned, 0 cases, 0 deaths. Yesterday, we had 3 cases and 0 deaths. And today, 10 cases and 2 deaths. So, our thoughts and prayers go out to the 1,235 families who've lost loved ones here on the Navajo Nation.
This past year has felt like a marathon, but we just have to keep going. It feels like we're on the final mile and we just can't give up. Could you share with us what some of the efforts and measures tribal and health leaders took to help bring these numbers down again?
Absolutely. We're still in a mask mandate. We started that mask mandate in April of 2020, and really putting some very strict and tough protocols in place here on the Navajo Nation. Weekend curfews, lockdowns, stay-at-home orders, and all that played a factor in pushing back on this virus. Overall, what has come to the Navajo Nation is 238,085 doses of Pfizer and Moderna and Johnson & Johnson. 196,902 have gone into the arms of our Navajo people. That's 82.7%, and 80,755 are fully vaccinated now. So that's a good number to have.
Those are incredible numbers. Now, how has the vaccination rollout been in Navajo Nation? Are tribal members getting enough doses at a satisfactory rate from the U.S. government?
Absolutely. I challenge the healthcare facilities here to get these vaccines into the arms of our Navajo people. I challenge them to stay above 75% of what we receive to go into the arms of our people, and that makes it easier for us leadership to request for additional doses from the federal government. Just want to say thank you to the Indian Health Services and all the self-governance 638 facilities that have been doing an outstanding job getting these vaccines out. And, I think the town halls that we've been doing and also leadership being on camera taking the vaccine has really brought confidence to taking the vaccine here on the Navajo Nation.
Now, COVID-19 cases are spiking again in a number of European countries because of the development of new variants, forcing them to re-implement safety measures and lockdowns. Some medical experts have said that what happens in Europe can be a forecast to what will happen here in the U.S. Are there any concerns among your administration and staff about a future spike in cases again, or do you think we will be able to achieve our new normal pretty soon?
Of course, there's a concern. We're monitoring, cases and the variants around the Navajo Nation. I think what is key here is to get as many people vaccinated because the vaccines have been said to push back on the COVID-19 and also the variants. And so here on the Navajo Nation, we're close to half of our total population vaccinated. So that's a race right now, is to get as many people vaccinated. Of course, we're not mandating it, it's voluntary. And so we are just letting our people know that it's safe to take it and look at the greater good here, not just about yourself, but for your family, your neighbors, and for the nation as a whole.
We really have to have that communal line of thinking in that instead of that individualistic type of thinking. President Nez, we have about 30 seconds left. I'd like to give you the final word. Anything else that you'd like our viewers to know, whether they live on or off the reservation, to know that we haven't discussed?
Well, first of all, I just again want to say to everybody, we're all in this together. People look at the Navajo Nation as a hot spot last year, and now how to be an example of keeping this virus out of the nation. But we're all interconnected, so whatever happens off the nation does affect the Navajo Nation and vice versa. So we're all five-fingered beings, and let us work to eradicate COVID-19 in our communities.
Well said. You've been hearing from Navajo Nation President Jonathan Nez. President Nez, it's been incredible seeing how you and your administration have responded to the pandemic. Thank you for your time and insight tonight. We appreciate you.
All right. Thank you, Rosie. God bless everyone.
Thank you. Welcome to our third and final In Focus discussion tonight on curbing the COVID-19 virus. Today was the first day that all Utahns over the age of 16 became eligible to receive the COVID-19 vaccine. However, Salt Lake County opened up their registration 2 days early. So what do local health experts and leaders want us to know as we sign up, and how are they handling this big task? Joining us now live via Zoom is Dr. Audrey Stevenson, Vaccination Director for the Salt Lake County Health Department. Dr. Stevenson, thanks for joining our discussion tonight. We appreciate your time.
Thank you.
Dr. Stevenson, how has the Salt Lake County Health Department prepared for this influx of registrations? Has the process been smooth so far?
Well, when the governor announced the eligibility expansion, we immediately began updating our systems and our protocols so that we would be able to accommodate that change just as soon as possible. And because of that, we were actually able to open scheduling on Monday, which was 2 days early. And because our team worked through the weekend to make all the necessary changes, we were able to do that. Now, so far, the process has gone very well. For example, in the first 24 hours that we were open, we had over 24,000 individuals make appointments, and the system worked exactly as we had hoped.
That is impressive. Good preparation on the county health department's part. Now, Governor Cox mentioned in his earlier news conference that Utahns should not be shopping around for different vaccines. There seems to be a lack of understanding about what the efficacy rates mean between the Pfizer, Moderna, and Johnson & Johnson vaccines. Could you help clear up this confusion and why Utahns shouldn't be comparing these vaccines?
Well, the best vaccine for any individual to get is the vaccine that's most easily available to the individual. Now, all three of the vaccines that are currently available locally are extremely effective at preventing serious illness, including hospitalization and death. So no matter which vaccine you receive, you're going to be very well protected.
Now, has the health department received any reports of someone being hospitalized by the virus following that 2-week window after getting vaccinated?
That's a great question, and the answer is no. We're not aware of anyone fully vaccinated in Salt Lake County having to be hospitalized. And all three of these vaccines are extremely effective at preventing hospitalization.
That's great news. Now, our COVID-19 numbers have continued to decline as our vaccination numbers grow. Is this indicative that the vaccine is the key for getting our lives back to normal?
Absolutely. We've said all along that vaccination is how we're going to end this pandemic and get back to our normal lives. And as vaccination rates increase in each of those eligible age groups of individuals, we've been able to see a direct decrease in the illnesses in each of those groups.
Earlier, I asked President Jonathan Nez of Navajo Nation if he's concerned about the new variants popping up in Europe, leading to a new spike in cases in several countries and prompting re-implementation of safety measures and lockdowns. Are local experts and leaders, and are you worried that that could potentially happen here in Utah?
Well, you know, we're watching the variants very closely, and we're going to thoroughly investigate and contact trace any suspected local variant that we identify so that we can keep them from spreading within our community. And there's really good evidence that that the vaccines are still effective even against these new variants, though how effective is still under investigation.
Dr. Stevenson, what is the next steps? What are the next steps from here? Will the county health department be opening more clinics? What do you have next on your plate?
So what we're doing within the communities is that there are multiple vaccination access points. We have vaccines in pharmacies, we have vaccines in healthcare systems, local public health, community immunization partners like NAMI, like community nursing service. So our next step is to continue to expand the availability of the vaccines so that each and every Utahn has access to that life-saving vaccine.
Has there been any lessons learned so far for our local health leaders and experts? I know that this has been sort of new waters that we have been navigating. Anything that we're taking from the past and making sure that we learn from that now?
Well, I think there were a number of lessons that we learned during the H1N1 pandemic. And a lot of that was, how do we get vaccines into the arms of individuals very quickly? And similar to the challenge that we had with the H1N1, the vaccine has rolled out in very short supply despite a very robust demand for the vaccine. So our lessons learned is to be transparent in communication, to try to reduce barriers for individuals to be able to have access to this vaccine, and to help the community to understand and to dispel the myths surrounding the vaccine.
Now, today, Governor Spencer Cox, he signed the COVID-19 endgame bill into law, which will end the statewide mask mandate on a hard date, which is April 10th. Is the health department preparing for any way in response to the governor signing this bill?
Local public health has traditionally followed the advice of the governor. We've seen that throughout this immunization process. As the governor's office announced each of the new eligibility groups, we have followed those, and we will continue to follow the mandates that come from the governor's office.
Dr. Stevenson, about 15 seconds left. Final words. Anything else that you'd like to include that we haven't discussed?
Just that we'd like to thank the community for their interest in being vaccinated and for their patience as we work hard to be able to vaccinate hundreds of thousands of people. You know, the vaccine is already making a huge difference, and it will continue to do so as long as individuals continue getting vaccinated. It's important to remember that the vaccine is safe, that it's effective, and it's our best hope of ending the pandemic and getting back to normal.
Always good words to hear there, and always a good reminder. All right, you've been hearing from Dr. Audrey Stevenson, Vaccination Director for the Salt Lake County Health Department. Dr. Stevenson, thank you for your insight tonight. We appreciate you coming on the show.
Thank you so much.